This is Dr. Jeremy Theal, and I've been asked today to present to you some examples of how electronic physician documentation can be used in an endoscopy unit. We have designed through a special InfoWay-funded ambulatory care program. We have created a special customized workflow for physicians to document findings and complete notes on patients coming for endoscopy, both inpatient and outpatient. The goals of this project were to create an efficient workflow that helps the physician document in a timely fashion so that the notes will be completed and available as soon as the procedure is finished, automatically sent to referring physicians and consulting physicians immediately after the procedure is done, and also to build evidence and research and quality standards into the workflow so that it's easy for physicians to meet all the necessary quality standards. And thirdly, we wanted to also have the physician be able to document findings and the diagnoses that they are providing for each patient in a discrete fashion so that the information is utilized within the hospital information system for decision support as well as research and quality improvement. So in the next few minutes, I'm going to show you examples of how we tried to achieve that: efficiency, quality, and discrete documentation of findings. What I'm going to take you through here is an example patient. This is a patient who comes to the hospital for a screening or a surveillance colonoscopy, I should say. This is a patient who's 54 who had a previous colon cancer resected 3 years ago and is coming back now for a surveillance colonoscopy to ensure that there has been no recurrence of polyps or other lesions. So I'm the endoscopy physician today, and I'm going to open an endoscopy note. What I have here is a set of pre-completed notes. You'll see on the screen here at the bottom where I have one for colonoscopy, one for a combined colonoscopy and upper endoscopy, one only for an upper endoscopy, the long name of that being an esophagogastroduodenoscopy, or EGD for short, and then we also have one for flexible sigmoidoscopy. These notes are called pre-completed because I've already filled in a lot of the parts of the template that are similar between patients in order to save time, and each physician who uses this solution is able to pre-complete notes in their own way so that the notes can be documented in their own fashion and they don't have to repeat elements that might have been necessary, for example, on paper or telephone dictation systems where they have to keep saying the same thing over and over again for each patient. So when I open my colonoscopy note, you'll see there's a bunch of blanks that are already pre-filled with the way that I like to work. This particular patient has, as I open the note, it actually asks me whether I want to include some information that the system already knows about the patient. It knows that the patient had a tonsillectomy 8 years ago. It also knows, at 8 years old, and it also knows the medications that the patient was taking before they came to the hospital and any medications that are ordered in the hospital. So in this case, I'm going to say go ahead and include those in the note because it saves me the trouble of doing that later. That's one of the advantages of this type of system. All right, so now what we're seeing as the note opens up, on the left-hand side, you will see some areas. They're kind of the table of contents of the note. And the note is basically set up to work in the same way that a physician would typically document this sort of procedure. And on the right-hand side is the details of each of those sections of the note. The sections that have check marks mean that there were some mandatory fields that I've already completely filled out, and the ones with red stars show me that there's some areas I have yet to fill out in order to have a complete note. One of the ways that we ensure quality with these notes is ensuring that we create fields that are mandatory so that the physician must fill those in before they're able to sign the note, and that way we don't have any missing information that might have accidentally been left out. So the first thing is in the pre-procedure section, and you'll see on the right-hand side the yellow highlighted fields are mandatory. I have to select the date, so I'm going to say that the procedure was done today. The system automatically fills in today's date, and I would just select a different one if I needed, but most of the time it's the date, the current date. The procedure is a colonoscopy. That's already filled in. It's being performed by me, and that's already filled in as well. In the next field, if I want, I can fill in the name of the referring physician. So I'm just going to put an example physician in there. And now it's asking me for the indication. So we've got categories that are collapsed so that it's easy to see the high-level choices, and then you can go into more detail if needed. I'm going to click surveillance, and surveillance will open up to say some different options. I'm going to say that the patient had a history of colorectal cancer, and their last colonoscopy was 3 years ago. So it's very quick to be able to document that type of common situation. In the next section is the consultation information. So this is where I would put some information about the patient coming for the procedure. I can actually include encoded diagnoses and problems. The system already knows that the patient has a history of some certain conditions. In this case, they had a history of colon cancer, and they also had a history of high blood pressure. I'm going to include those terms in the note, and those terms are discretely identified by the system and are actually encoded in a standard international terminology called SNOMED CT, which allows you to categorize in a very granular fashion diagnoses and findings for a patient. It already included the information about the tonsillectomy and also the medications that the patient was taking before they came to the hospital, so that's all finished. Now, the other thing that I'm able to do in this situation is I'm able to document some narrative text, because although point-and-click templates are wonderful in and of themselves, sometimes if you're only using point-and-click template information, you can lose the story of the patient. So we've provided in this system for the option for the clinician to be able to go in and add some narrative text as well. So I'm just going to go ahead and add that here above the procedure history, and I'm going to use a voice recognition technology. I'm going to speak into a special microphone in the computer that will then translate my speech into text. This 54-year-old gentleman presents for a surveillance colonoscopy period. He had a right hemicolectomy 3 years ago for adenocarcinoma of the colon, period. He did not require any chemotherapy, period. He has been asymptomatic since his surgery, period. In particular, comma, there has been no change in bowel habit, comma, no abdominal pain, comma, and no rectal bleeding, period. His appetite is good and his weight is stable, period. He has no new health conditions since his surgery, comma, with no hospital admissions, period. So you can see that the speech recognition technology is quite good and was able to capture all of the text that I said without any errors. So I'm going to move on. The next section is a physical examination where I can also insert typical findings. And much faster than I could write or dictate my physical examination, I have all the standard fields that I would need to fill in for the different sections of a physical examination, such as examining the head and neck, respiratory, cardiovascular, or gastrointestinal systems. And I also have the ability to fill in a macro here. So I'm actually going to use a macro to allow me to fill in all the fields automatically with normal findings. In this case, there weren't any abnormal findings on the person's physical exam, so I was able to very quickly fill that information in. The other thing I'm able to do is bring in other information from other areas of the chart that have been documented by other providers. For example, the nurse may have already documented the patient's vital signs, and I wanted to perhaps include that in my note. I can do that quite quickly by inserting an extra sentence from elsewhere in the chart, and I can include the vital signs from the flow sheet. So I'm going to select the vital signs that the nurse documented, and now those are populated in my chart as well. So you can see that we've been able to save time for the physician in multiple aspects by bringing in vital signs information as well as medications, past medical history, past procedure history, all into the note automatically, and then still be able to add narrative text. So let's move forward now to say we're going ahead to do the colonoscopy. I've already filled in that I'm using an adult colonoscope here. I'm working with an anesthetist, so I'm going to say to see the anesthesia record for the sedation information. The rectal examination was normal. The bowel preparation quality was quite good, so in this case I'm going to select the Ottawa scale, which is a research-based way to express the quality of a bowel preparation by segment of the colon. This is something that's typically somewhat difficult for clinicians to be able to document on paper or by telephone dictation because it's difficult to remember all the different parts of the scale. But because we've built this into the note, it's quite quick for the physician to be able to fill it in online. In this case, I'm going to say that other than in the right colon, the bowel preparation was good, so the prep was good overall. Extent of examination, in this case I examined all the way to the opening of the terminal ileum, so I have a macro set up which automatically populates that because that's a very common way that we would document a colonoscopy. I did perform rectal retroflexion on withdrawal, which is what I typically do, and so that's already defaulted into the system. And as well, the difficulty of the procedure, there weren't any problems. So I've filled in all those automatically to be able to make things faster to fill in. And then in terms of findings on the colonoscopy, we've got an option for normal throughout, which makes it very fast to document a normal colonoscopy. Basically, you're finished as soon as you click that. But if there were any abnormalities, you can add them. In this case, I'm going to say that I found a single polyp. There are many different positive findings here, and they're categorized alphabetically for the physician to be easily able to find. I'm going to click on polyp. I'm going to click on a single polyp. I'm going to say that it was 5 millimeters in size. It was found in the sigmoid colon. It was pedunculated on a short stalk. I did a hot snare polypectomy, and I was able to completely remove the polyp and not have any bleeding, and it was successfully retrieved. So the template is set up to be very quick to be able to document these types of common findings. The next section allows me to insert an image of the findings because our system has been set up to actually capture pictures from the endoscopic equipment, the processor. So in this case, I took a picture of the patient's terminal ileum and appendiceal orifice to prove that I did get all the way around the colon, and I also took a picture of the patient's polyp. I'm going to select all of those pictures, and then I'm going to insert them directly into the note. The next thing I'm going to do is also insert a cartoon of the colon and be able to indicate where I found the polyp so that anyone reading this note would have a visual representation of where the polyp was found and removed. And so once those sections are complete, you can see now that the cartoon as well as the pictures have all been inserted into the note. The last step is for me to be able to dictate my impression recommendations, and we've intentionally left this field open as a narrative text, a section that the physician would be able to just openly dictate what they feel about this patient after the procedure is completed. So I'm going to dictate now. This 54-year-old gentleman underwent a complete colonoscopy to the terminal ileum for surveillance purposes, period. The only abnormality found was a single short stalk pedunculated polyp in the sigmoid, which was about 5 millimeters in diameter, period. It was successfully removed with an electrocautery snare and retrieved for pathology, period. Pathology results are pending, period. If this is a typical adenoma, then a repeat colonoscopy would be recommended in 5 years, period. If this is a tubulovillous adenoma, then a repeat colonoscopy would be recommended in 3 years, period. If there are any other unusual findings on the pathology, my office will be in contact to arrange an alternate screening interval, period. Many thanks for involving me in the care of your patient, period. So I've dictated my narrative section, and for the most part there are no errors except for where it said undulated polyp instead of pedunculated. So I'm just going to correct that. And everything else looks pretty good. So the next section, the final section, is for me to dictate or for me to add any recommendations to the patient and follow-up recommendations as well. So I'm going to say that a repeat colonoscopy is recommended. In this case, I will say in 5 years. And I will make a note with my voice recognition. Repeat colonoscopy may be required sooner than 5 years. Repeat colonoscopy may be required sooner than 5 years, depending on pathology results. And I'm going to ask the patient to follow up with their family doctor for further management. And now I have a section where I can actually indicate the diagnosis of the patient. And this section is using discrete data forms, in this case SNOMED CT, to record the information in the system. I'm going to say that the patient had a colonic polyp, and that was the only finding of concern. Now I'm going to sign this note and submit it to the system. And you will see now in the diagnosis and problem section that that colonic polyp is now visible.